The Canadian Nurses Association's mission is to make nursing better for nurses, for patients, and for our public health systems. As such, we are delighted to sponsor the college's Nursing Leadership Award. Together, we celebrate outstanding nursing leadership, reflecting our shared commitment to advancing healthcare excellence for nurses. There's 500,000 of us. We're 1 in 57 voters, $40 billion in spend here in Canada. We are a force and a power. This year's award recipient is a visionary nursing leader whose 4-decade career has advanced patient-centered care, equity, system transformation across Canada and around the globe. She is also recognized as a trailblazing MP who broke ground for generations to come, starting in the 1980s at a time when the MP role was new to Ontario and Canada. From serving as Ontario's Chief Nursing Officer to shaping global policy as the inaugural Chief Nurse of the International Council of Nurses, her influence is profound. Her leadership has transformed how we provide care to Ontario's aging populations by creating Ontario's first nurse practitioner-led hospital and the successful SAFE model for senior care. As the CEO of the Nurse Practitioners Association of Ontario, she continues to modernize advocacy and practice, strengthen access, collaboration, and the future of the nursing profession. I am deeply honored to recognize Dr. Michelle Acorn, a transformative leader and advocate for excellence and a newly appointed fellow of the college as well, as the recipient of the 2026 Leadership Award for Nursing. Congratulations. Please join us on stage.
That's a long walk, and just to let you know, if you heard the years, I'm quite mature with my wisdom highlights, and this has been an epic weekend for me. I just celebrated my son Alex's wedding last night, if you can believe it, with my 4 adult children and 5 grandchildren and 6 on the way, and I danced all night, so I wasn't sure if I was going to get up these stairs or get down them safely. But courage is the moment you step forward before you feel ready. That single truth has defined my entire journey of leadership. When I look back through clinical practice, policy reform, organizational leadership, and now this recognition, one word rises above all others, and that's courage. Not the cinematic kind, but the disciplined and sometimes unglamorous courage required to build what has never existed before. The courage to challenge systems that were never designed with nurse practitioners in mind. The courage to stand in complexity and keep moving away and forward. There's a quote that's anchored me. Courage is not the absence of fear, but decisions that something else is more important. The people we serve, universal health care, the professions that we shape. And another guide, truth for me, is that courage is the power to let go of the unfamiliar. None of this would happen without the courageous conversations when emotions are high, but stakes are higher. That asks us to name what is not working, to confront long-standing assumptions, to sit in the discomfort of change. These conversations where systems evolve. They are where leadership becomes real. But courage is never solitary. It grows in communities such as this here today. To the Nurse Practitioner Association of Ontario, thank you for nominating me and trusting me to lead us through this complexity and rebuilding with intention, purpose, and deliberation. To the CCHL, thank you for recognizing the discipline, governance, and stewardship behind the work, and LEADS for giving us that shared language that's principled for courageous leadership as well. And to the Canadian Nurses Association, thank you for amplifying United Nursing leadership. Nationally, nursing has always been the engine of courage in our healthcare system as well. To the leaders across our system, thank you for modeling courage in action. I close with words of Gord Downey, who reminded us, courage sometimes is simply the strength to keep going when the world asks more of us than what we expected. It captures the persistence, bravery that defines our leadership, visible and invisible legacy contributions. If courage is the strength to keep going, then this is our moment to step forward intentionally, because courage is the force that changes systems, lifts leaders, and shapes the future we're bold enough to claim together to ensure we leave no one behind. Thank you so much for this honor and privilege.